Well, tonight we continue to bring you answers to coronavirus questions. News Channel 3's Caitlin Thrope spoke with a Valley doctor about testing.
We're answering your viewer questions about the coronavirus. Chief Medical Officer at Eisenhower Health, Dr. Alan Williamson, provides us those answers. Here's one question. Overall, Dr. Williamson, how is testing going here in the Valley, and what's Eisenhower's role look like?
Even patients that are completely asymptomatic or individuals in the community that are completely asymptomatic can potentially be tested. At Eisenhower right now, we're not capable of doing that. We don't have the supplies available to us yet to be able to test everyone routinely. So we're still following the guidelines for patients that are symptomatic and providing tests for those patients.
And how long does it take for someone to get their test results back?
We have a capacity to do the test here at Eisenhower as of about 2 weeks ago. But unfortunately, we have a relatively limited capability of doing that in terms of the numbers that we can do. So we try to be selective in patients where we believe knowing the answer quickly is going to be most critical to us. If it's less clear that we need to have that answer right away, then we do send the test out to outside laboratories, and the turnaround time varies from laboratory to laboratory and day to day, but typically is anywhere from 2 to as much as 4 days.
If one person's test comes back negative, how long should they wait to get tested again?
If I'm tested, then I'm concerned maybe the next day for some reason I was exposed. If you go out and immediately get tested again, the odds are it's not going to be positive. So it's typically going to take anywhere from 2 to 7 days after exposure before we begin to develop symptoms. And typically, once the patients begin to have symptoms, then we will start seeing the PCR test become positive. We do have a few patients that are PCR positive before their symptoms start, but for the most part, it's usually pretty much hand in hand that the test becomes positive about the same time they develop symptoms. So if you are concerned about an exposure, I think you still need to wait typically at least 3 to 5 days before there's any likelihood that retesting is going to be of any benefit to you.
Thanks, Dr. Williamson. If you want to see our other questions answered, just head to KESQ.com. You can also send in your questions by emailing coronavirus@KESQ.com.